Hello, everyone. This is Dr. Seema Balian, and today we are going to go through the professional values in the new OSCE station. So I'm sure that all of you are already aware that this is one of the topics which have been recently introduced in the new test of competence 2021. And it has obviously added to the anxiety of the candidates that because it is one of the new topics which was completely introduced for the very first time. This is causing a lot of anxiety. So I'm hoping that this video is going to answer some of your anxieties and some of your questions, and you are going to be feeling more confident in handling this scenario and the station. Okay, so let's get on with it. So professional values station. It is a silent station. You will be given 10 minutes to complete the station. You will need to complete one scenario of the professional values out of the 5 scenarios which are there. You will need to use black pen to complete the station. You make sure that your writing is clear and legible and that you complete all aspects of the scenario and the paperwork. Please do not rewrite, overwrite, or cross out if possible. A single cross with your initial on the top is acceptable. So as we all know that professional values again are something that we all comply with, we all possess, and we all are always taught and we always work towards professional values. Professional values is also one of the key focus of the NMC code. And the NMC code is like the core, you can say that it is the one of the most important which is going to compile all of the ethos of being a nurse and how to practice as ethically and according to the code, and in where we are prioritizing the patient and where we are actually looking to do the very best for the patient. So I think that professional values are always there and we always do practice with it. But sometime again, when we are asked to actually handle any scenario in relation with any one particularly difficult sometime to actually answer that. And that is where the anxiety comes. Hopefully, once we are gone through and the scenario and the marking criteria and the example, I think that that is going to reduce your anxiety to a certain extent. Okay, so as I mentioned earlier, there are 5 scenarios out of which you are going to get any one in the exam. The scenarios are confidentiality, drug error, possible abuse, professional confrontation, and social media marketing. So I'm sure that you would relate to all of these topics, which are very, very commonly you will come across in your day-to-day professional life. Confidentiality is again the core of being in a medical profession. So you have to make sure that you are respecting the confidentiality. Drug errors, because we are dealing with the medication and the drugs day in and day out, it is quite possible that there drug errors do happen, and you will need to handle that situation very professionally and according to the professional values. Possible abuse, this is again very common, and you would in your professional life will see a fair share of cases where there is a potential abuse that has been happening. Professional confrontation, I think that when there are so passionate people who are working together, it is not uncommon to come across a situation where you are not agreeing with what the other person is saying or their ideas about the other person's views and things. But I'm sure that everyone tries to work towards the best interest of the patient. So this is not uncommon, but majority of the time it is handled very professionally, and it is resolved very amicably. Social media marketing. This is something which is kind of a very latest and a new problem, although in some form or shape it has always been there. But we have to be more and more aware of the social media and our responsibility towards our patients and our profession, and to be very conscious of the fact that if we are going to be putting up anything in the social media, that it is not in any way compromising our professional values. So these are few of the topics which are there, and you will be getting 1 out of the 5. So we will be discussing one scenario for the professional values. Now, that scenario is not out of these 5. That is one of the scenarios which NMC have given in their mock. But I'm sure that while going through it, you will recognize that how to answer these type of scenarios. So the marking criteria, the general ethos stays the same. So you will get it as per the scenario, but it's the same with the same ethos. In order to answer the station correctly, you will need to understand the principles behind each scenario. You will need to go to the art, and which will give you the back this particular station and the booklet. Yeah, so going ahead, if we are going to go ahead, let us come to the example. So we are going to be taking the example of drug misuse. Now, drug misuse is again a very common thing that happens, and this is unfortunately something that one way or the other we do come across in our part of sort of our day-to-day life. But this is something that we need to understand that goes slightly against the professional values, but it needs to be handled with care, and it needs to be handled very sensitively. So if we are going to be taking a scenario, and the scenario is that you are just about to commence a lunchtime drug round, and 30 milligram codeine phosphate tablets from the drug cupboard she puts in her mouth and swallows it in front of you. You ask if she's okay, and she tells you that she needs the tablet for headache. As far as you are aware, this is an isolated incident. So using the instruction says that using your knowledge of NMC, the code professional standards of practice and behavior for nurse midwife and nursing associate, consider the professional, ethical, and the legal implication of this situation. And you need to summarize your actions in it is a silent station. You have 10 minutes to complete this station. So now let us go through the criteria that what this is going to be marked against. So the criteria says that you recognize that taking NHS hospital property for personal use or gain, including medication, is prohibited. You recognize professional duty to report any concern that may result in compromising the safety of the patient in their care or the public, and that failure to report concerns may bring their own fitness to practice into question and place their own registration at risk. You raise concern with the manager at the earliest opportunity, verbally or in writing. You recognize the need to be clear, honest, and objective about the reasons for concerns, reflecting duty of candor. You recognize that the manager may wish an incident report to be completed, recording the events, step taken to deal with the matter, including the date and with whom the concern was raised. You take into consideration own responsibility for the safety of the colleague and consider the effect of codeine on their ability to work and drive home. You consider that the colleague may need a medical review for the headache or may need support dealing with the substance misuse problem. And you acknowledge the need to keep an up-to-date, to and uphold the standard and the values set out in the code. Handwriting is clear and legible. So these are the criteria against which you will be assessed with regards to this station. So now let's see an example of the answer. So if we see in the answer, then again, it is going to have the candidate name. You are going to consider the professional, ethical, and legal implication of the situation, and you will need to summarize it in the bullet points. So we are going to, the answer can be that as per the NMC code of practice, as a nurse, we should always follow ethical practices and be professional in our approach. Taking medication that is not prescribed and are not for your use is not a professional behavior. Noticing such behavior from a colleague will make me think about my duty toward my colleague, my profession, and myself. As a caring person, I will first check with my colleague regarding her health and if she is feeling okay. After this, I will also discuss with her the implication of taking a medication from the drug cupboard. I will ascertain that if she is aware that this is not the correct behavior, and I will also try and understand her reasons. I will then encourage her to discuss this event with the ward manager and admit it as a mistake and reflect upon it. In the event of my colleague not complying, I will be under professional duty to report this incident in confidence with my senior. Once the incident has been discussed, it will be important to reflect the need for supporting the staff with the correct information and behavior. There might be a need for policy or protocol change, and also a need for education on how can such incidents be avoided in future. During this whole process, I will make sure to follow the principle of the code. So we can summarize the things as a bullet points, and this is one of the examples that how you can write this one. By no means I'm saying that this is the 100% accurate example, but this is something that we are trying to follow all the principles of the code. We are be supportive with the colleague, but at the same time, it is important to recognize my duty towards my profession and towards the patient and towards my colleague as well, and do the right thing, and make sure that there is the education and reflection aspect of this incidents is also looked after, and there is, if required, a change in the policy or protocol and a better education with regards to these type of incidences, so that in future the staff is more supported and they do not have these type of incidences. So I hope that this example and the sample answer would have given you a more insight onto how we can answer the questions related with the professional values. So that is all what I had to discuss about the professional values. Definitely, when you will be coming for the further training, we are going to go through the all of the topics which are there, all of the 5 topics which are there, which comes in the exam, and you will get more practice. The code, the NMC code, which is going to give you more, and you'll be able to handle any type of dilemma and the ethical questions very easily. Okay, thank you very much for listening, and I hope that today's video would have been helpful for you to understand the professional values, and you will feel more confident in going much more prepared to appear for your NMC OSCE. Thank you very much and good luck. Bye-bye then.